you can see my slides clearly and if you can hear my voice clearly, please click on the raise hand icon that is part of our Zoom webinar software. Thank you so much. It looks like we're good to go technology-wise. I have a couple of reminders before we get started. Reminder number one is that this upcoming Friday, we're gonna have the Understanding Menopause in the Workplace webinar, hosted by our Employee Assistance Program. Therefore, if you haven't registered for this or any of our upcoming webinars, I invite you to do so through our Wellness Program website. Our second reminder is that you are on listening only mode. However, you are able to submit your questions via our Q&A forum on our Zoom webinar software throughout the presentation, and we will answer them during our Q&A session. At this point, I have the pleasure of introducing our guest speakers for today's presentation. Our first speaker is Ricardo Saenz Jr., a certified recovery specialist. Our second speaker is Dr. Rene Ramon. Dr. Ramon is a graduate of Texas Chiropractic College, and he has been a certified Airrosti provider since 2013. And our third speaker is Juan Gaona. Mr. Gaona is the Director for Business Development for Airrosti Rehab Centers. And he is passionate about developing strategies to lower treatment costs and, most importantly, educate on a solution to musculoskeletal pain for South Texas. Without further ado, I pass it over to you, Juan. Thank you for being with us today.
Good morning, Diana. Good morning, everybody else. Thank you for joining us today. I'm going to go ahead and share my screen real quick. There we go. Okay, good morning. Like I said, thank you for everybody for joining us today. Like Diana said, my name is Juan Gaona. I am the Director of Business Development for Airrosti Rehab Centers. And today we're here to talk to you a little bit about health at your desk. Is too much sitting contributing to your chronic aches and pains? Real quickly, for those of you that are not familiar with Airrosti is a healthcare group of providers that specialize in resolving soft tissue injuries. When I say soft tissue injuries, it can be anything like low back pain, shoulders, knees, hips, bottom of the foot pain. We can typically take care of these injuries and conditions in an average of 3 to 4 visits. So it's quick. We don't use injections and we don't use medications to do this. These are one of the things that we treat in the office. So you can see one of the big questions might be, well, what are soft tissue injuries? What are MSK, musculoskeletal conditions? Well, it's everything on this list right here. We can treat anything from head to toe. We have some big players on here like headaches, migraines, carpal tunnel, plantar fasciitis. If you do not see what you have going on this list, doesn't mean that we don't treat it. It just means that we didn't have room for it on the list. Our providers start off every single appointment with a thorough examination to find out exactly what the root cause of your injury is. So if you were to come in, let's say for back pain, we'll do an examination to see if the back pain is being caused in that area or is something else contributing to that pain so we can resolve it. Our goal is always to get rid of the pain in an average of 3 to 4 visits. But again, our main goal is to make sure this pain never comes back. So you will be prescribed some exercises and stretches that are designed to help build up this tissue to make it nice and strong. Like Diana said, there is going to be a time at the end for questions. If you have any questions throughout the presentation, go ahead and submit them to her. If we do not get to your question, or if you don't want to ask your question right now, there is a little link right here in the bottom that's for a VIP chat. These are designed for you to have a one-on-one conversation with our provider, Dr. Ramon. You'll have time with him 15, 20 minutes, maybe even 30, depending on how your schedule looks, just to kind of talk to them about what your condition looks like and what we can help you with. The reason why we brought in VIP chats or the conversation piece of this is that traditional care can look a little confusing sometimes. Usually I do this question in person, so with the webinar it's gonna be kind of weird, but I always ask, if you had a tooth pain, where would you go? Typical answer would be the dentist. If I were to ask you, where would you go for an eye issue? The typical answer would be the eye doctor, we hope, right? But if I were to ask you, where would you go for lower back pain? I guarantee you get a variety of different answers. So we got like PCP, ER, orthopedic, physical therapist, chiropractic. All of these providers are great, but they all have their own protocols on how to solve these musculoskeletal conditions. So once we kind of get into the mix of all of these different providers, that's when it gets a little confusing and a little costly. So what Airrosti did is we put ourselves ahead of all of those and kind of make these VIP chats available for everybody for the county. If you're to do the call and we go through the examination and we find that you are not a candidate for Airrosti, we can still refer you out for those x-rays, MRIs, or we can refer you out to any of the other providers. This is just a chance for you to have a free conversation with one of our docs. Like I said, it's a one-on-one chat with one of our providers. It's easy, convenient. We have many available spots. It's not just a certain day that you can jump on a chat. You can jump on a chat at any time or day. So if you're not dealing with anything right now, that's okay. You know, scan the code, save the link, and if anything ever comes up, we're there to help you. Again, it's no cost and no obligation. So we don't ask for any type of insurance or any kind of credit card information for these. It's a one-on-one conversation with our providers. So like I said, today we're here to talk about health at your desk. We're going to understand the effects of prolonged sitting on our bodies. We're going to talk about conditions, pains that may occur. I'll pass this on to Dr. Ramon at this point. And then Rick's going to jump in and talk us through some tips and prevention. And then we'll go for a little bit of, why Hidalgo County has partnered with Airrosti to give you this information. And then, like I said, at the end, we'll have time for questions and answers. So why should you care? Well, main one first is it's estimated that 80% of all Americans have a job where we're in a seated position. It's also about 7.7 hours, maybe 8 hours a day that we are sitting. Now, this is also maybe bumped up a bit because we don't take into account the time that we sit to travel to and from work, with the time that we sit for lunch, dinner, breakfast, or just when we kind of go home and have some downtime and we're sitting down. We are here to talk to you about musculoskeletal conditions and what can happen from being sitting down for too long, but being in a seated position for too long can also correspond with risk of chronic diseases like blood pressure, diabetes, and kidney disease. So what is it? So why does this occur? So as you can see, when this our little design right here, our character is sitting down. When we sit down for too long, we have that forward transition of the head, our shoulders pinch forward and roll internally, the spine is placed in a different position, and then our hip flexors are shortened. And in a little bit, Dr. Ramon's going to talk to us about why the hip flexors play a big role in lower back conditions. Another reason why this is important is that the workspace has looked a little bit different from here on out, right? Once COVID hit, a lot of us were sent home to work from home, or kind of, we can't move too much in the office. We have to stay in our little cubby hole. So that's why it's very important for us to have this conversation right now. I know some of us, like myself, when we were sent home, we didn't have an office desk set up for ourselves. So we were at the kitchen table, the couch, anywhere that we can set up our laptops or our computers, right? So that definitely didn't help with the position, where we should be. Now that we're getting back to like virtual meetings that we're doing right now, it's definitely time for us to talk through these conditions. Some of the things that can occur from being in a prolonged time sitting are muscle pain, like through the neck, shoulders, and upper back. We could have some stiffness, fatigueness, headaches, sore back, inability to focus, numbness, and tingliness. So a lot of the stuff that Rick's going to cover is going to help us kind of break away from these habits, especially to take away some of those headaches. Sometimes if you're sitting down for too long, you can't focus. So we'll give you some exercises and some tips to kind of break away from that. I'm going to now pass it on to Dr. Ramon to kind of walk us through what upper cross syndrome and lower cross syndrome is.
All right, thank you. We're going to start out with upper cross syndrome, folks, and this is something that we see here in the office quite a bit. It's a general syndrome. It's composed of a few different conditions that do make up upper cross syndrome. But because of the way we sit, because of the way we drive, because of our posture, we tend to develop these weak muscles in the front of the neck and also weak muscles in the mid-back as well. And as for compensation, what happens is the body's going to start to tighten up the upper trap area and the area between the shoulder blades. And it's also going to start to tighten up your chest. For those of you who have the desk job, using your mouse, you're using your phone, we're using technology, that chest does tend to tighten up right over there. So that's one of the more common areas that we're going to treat to give our patients some relief for their upper back pain, for their neck pain and headaches and so on. We're going to get into those conditions here next. Okay. Lower cross syndrome, very similar. We're just talking about the lower body now. This is a big common cause of some hip pain, some glute pain, some lower back pain as well, okay? Again, we have two components that are weak. That's going to be your abdominals and that your glutes as well. And the glutes become weak because most of us, for the most part, we sit too much. And really the body sort of forgets about that glute. The brain sort of forgets about the glute because instead of being active like we're supposed to be, you know, we sometimes have jobs that require us to be seated, you know, from 8 to 5, Monday through Friday. And then for some people, it's even more than that. You also spend time at home being seated. You also spend time in your vehicles being seated as well. So what also happens is that low back on the backside gets tight. Your hip flexors in the front also become tight as well to compensate. So these are areas, anything that's tight, what we're trying to do here in the office is to loosen them. And anything that's weak, we're going to want to strengthen those up, okay? So total on sitting, we have some common conditions. First one we're going to cover is going to be our mid-back. Generally, we see some pain between the shoulder blades. That's pretty much the most common one. It can be sometimes present as a sharpness, sometimes can present as a burn, a deep, dull ache. There's also some times where the ribs get involved as well, where not only do you have pain between the shoulder blades, but you also have pain that shoots across the chest to the sternum, to the chest in the front, okay? So we have some of these, we have part of this upper cross syndrome is going to be this mid-back pain here. One of the key players is going to be the weakening of the rhomboid muscles there in between the shoulder blades. And again, in the office, that's going to be something that we're going to want to strengthen. It's a very, very common thing that we treat here. Okay. Tension headaches, tension headaches get their name from the source. The source of these headaches is going to be the tension in those muscles at the base of the skull and at the upper neck. So you can see on the picture there, we've got a few muscles. They're very short. Some of them are 1/4 inch long. Some of them are 1/2 inch long, maybe 2 inches long at the most, okay? So for all those tight muscles right over there and those muscle spasms that tend to develop, we're gonna wanna go in there and do a little bit of manual therapy to release that tension, okay? We're also going to want to work on a little bit of strength exercises to help this compensation that's been happening, right? If we're looking at a screen all day, we're looking at our phone for for some time, we're going to be pulling our head forward. These muscles in the back of the neck and at the base of the skull are going to become a little bit weak. They're going to start to fire. They're going to start to spasm and contract really, really hard in order for us to help pull that head back. So they do need some help. They need to be released, and we also need to strengthen them up at the same time, okay? Thoracic outlet syndrome, and also another component of the upper cross syndrome, but thoracic outlet syndrome is going to be some numbness and tingling that's going to the hands and to the fingers. Now, the reason why we show you the chest here is because that's where the source is coming from, okay? This is like finding, if you're going to water your front yard. This is like when you turn on your water hose. You turn on the faucet and the water, and you notice that it's just kind of sputtering, it's coming out. Well, you might have a kink or two in that hose, okay? And that's what it's all about, is finding out where this kink is happening for your nerve and your blood vessel that supply your hand and your fingers. Most of the time, we find this happens at the chest. Again, we talked about the tightness of the chest muscles. We have the pec major and the pec minor there shown on this little picture. And from prolonged typing and mouse work and computer work, and phone work as well, we're going to tighten up those muscles, and that can tend to pinch and compress some of the nerves and the blood vessels that are underneath those muscles. They supply the hand and the fingers, and that's your source of numbness and tingling. Typically, you'll see this on people. They tend to wake up if they sleep on the side that's affected. They're going to have that numbness and tingling when they wake up in the morning, or it could even wake you up in the middle of the night, okay? We have tests to verify that this is going on, and we have good treatment also to work on this issue. Lower back pain, like Juan said, 80% of the population is going to have some significant lower back pain in their lifetime, and it happens for a few reasons, but in our topic here, it's health at your desk, right? The hip flexors in the front of the body, which is the only lower back muscle located in the front of the body. That's something that we love to explain to our patients because it's not something that you think about often. But the lower back, okay, we got a front side of the lower back and we got a back side of the lower back. In the picture, the guy is pointing to the lower back on the back side, but in the front side, that hip flexor is a muscle that tends to get tightened and shortened whenever we sit too much, right? That prolonged sitting comes into play again. And because of that, you're gonna tighten up that lower back muscle. Those are gonna get tight and spasmed up. Well, eventually they're gonna pull a little bit too hard, those muscles attach to your tailbone, they attach to your pelvis. They're going to pull a little bit too hard, and they're going to cause a little bit of sharpness, maybe some stabbing pain. You can even compress some of the nerves in the lower back, making some pain shoot or radiate down to the buttocks, to the legs, to the feet, to the toes. You can also have some numbness and tingling as a result of this particular condition right over here. Okay, thank you.
Thank you, Dr. Ramon. Like we said, if you have any questions on the topics or the conditions that Dr. Ramon was talking about right now, you can sign up for one of those VIP chats and talk to him one-on-one, or send that information right now to Deanna, and we can go ahead and get some of those answered at the end. Next, we're going to be talking about preventing upper cross syndrome, preventing a lot of the conditions and pains that Dr. Ramon just talked about. So this is just a little reminder for everybody to be in a good posture. This is what we, on the left side is what we call incorrect posture position, and this is what we call correct. I know typically in the mornings this isn't an issue, but after lunch, around 1 o'clock, 2 o'clock, we get a little tired. We start to slouch forward a little bit. And sometimes we don't even know it. Sometimes we're just so invested in what we're doing that you don't know that you're in this bad position. So this is where a lot of anybody that's on the call that works in the same department, let's kind of remind everybody or remind each other that good posture is going to lead to no pain at all, okay? When it comes to preventing, we always want to work through through a couple of things. So we definitely have some strengthening exercises, stretching, and then we'll talk a little bit about foam rolling towards the end. So what I'm going to do now is pass it over to Rick. He's going to talk us through some of the exercises that we can do throughout the day. I know we can't see everybody, but that's okay. If you want to try some of the stuff that he's going through, it's fine. If you have any questions towards the end, you felt different or you didn't feel what he was talking about, we can maybe talk through it at the end. It's all yours, Rick.
All right, good morning. So today we're gonna go through 7 little exercises we can do. Most of these, almost all of these can be done right at our desk in the office. So number 1, we're gonna start off with an executive stretch. This is one of the easiest ones to do, and many of us do this without even knowing it. As in the picture, I know you can't see me do it, but I will be doing it along with you guys. We're gonna sit up nice and tall in our seat. We're gonna bring one of our legs over our opposite knee, okay? From this position, we're gonna place one hand on our ankle, one hand on our knee, keeping that chest high, back straight. We're just gonna hip hinge. We're just gonna lean our body towards our leg, and we should get a good, nice pull in that glute and hip area. We don't wanna feel any pain in here, no numbness, tingling, nothing like that. If we do ever get too sharp of a pain, let's just back off a little bit and just have a nice, consistent stretch there. I like to hold that 30 seconds to a minute. I'll slowly lower that leg down, switch over to the opposite side, repeat the same thing. Do these 2 to 3 times a day throughout the day. Will prevent a lot of back issues and just sore butt muscles throughout the day. All right. So seated row. In the picture here, we're doing a simple row. If a lot of you guys go to the gym, this is kind of like a bent over row or a cable row. In the picture, she's not using a band. Here in the office, we usually have a light band assisted with this. So you can imagine we're seated, chest up. Our arms, we're gonna put them forward, so straight in front of you. From this position, we're gonna drive those elbows straight back past our torso, squeezing those mid-back muscles. We want to keep the shoulders nice and low here. We don't want to be raising our traps too high. Keep everything nice and low, good squeeze. We'll slowly retract those shoulders all the way back forward, take a little pause, and then right back to it. This is easiest seen in the gym with the seated cable row. We could do it with a band or with no weight at all in this case here. All right, so this one's pretty easy, guys. Right at your desk or right at your chair, we're gonna pick a side. So I'm gonna do my left side right here. Our left arm, we're gonna grab the bottom of our chair, okay? Chest up, back straight, and holding the chair, we're just gonna tilt our ear, our opposite ear to that same shoulder. We should get a nice stretch right there on the side of our neck. I like to hold that for about 30 seconds. After that, holding that same position, I'm gonna tilt my nose upwards. So I'm just looking up. Now that stretch should switch over to the front of the neck. Hold that there for about 30 seconds. And then from there, we're gonna go nose down. We're looking nice and slow to the floor, and that stretch should now be felt in the back of the neck. Each one, 30 seconds to 1 minute, back off slowly, and we'll switch over to the opposite side and repeat the exact same thing. 2 to 3 times a day is great for this stretch as well. Releases a lot of that tension in the neck after a long day's work at the computer. All right, chin tuck. So this is one, it's very visual. You almost have to see me do this to kind of see what we're doing here, but same thing like before, chest up, back straight. The goal here, if you put your 2 front fingers on your chin, imagine you just want to push that chin straight into the back of your neck. You should feel those front neck muscles dig real deep, get a good stretch. We'll hold that for about 3 seconds, and then we'll slowly drive our head forward and relax there for a second or 2, and then repeat, chin straight back into the neck. It almost gets a little harder to talk when you do that. We'll hold that for 2 to 3 seconds and then slowly relax. I like to do a set of 15 of these in the morning and then a set of 15 after work, so we don't get that forward head lean that a lot of us get with computer and desk jobs. Again, there should be no pain during this motion, no pain in the neck at all. Okay, BRUGGER. So we also kind of have a different version. We call these Fonzies as well. But as you can see, we have a light band here. If you can place your elbows to your side and your hands right in front of your body, if you imagine a band between the two, all we're going to do is separate the hands, externally rotating our shoulders. So the end position is actually the position that this man is in right here. We're starting from the front, pulling out to the sides, and then from that position, we're actually driving the arms away from the body. It's kind of hard to see that in the picture, but a different version is Fonzies, where we just rotate the hands from the front of us to the side of us, keeping that chest up, squeezing those mid-back muscles together, squeezing 2 to 3 seconds, slowly relaxing to that front starting position. Same thing, a set of 15 here, 2 to 3 times a day is a great start for this exercise. All right, hip flexor stretch. This is one of my favorites. It really helps with low back pain and tight hips in general. So you can see in this picture, if we want to stretch the right leg, right, pretend our right hip's tight, we want to stretch that out. We're actually going to kneel down on the floor on the right knee. Our opposite leg or left will be in front of us a good ways. We don't want to be in a closed stance. We want to be nice and wide for balance here. From that position, we're going to hip tuck. So think of your tailbone, you're trying to tuck it under you, kind of you're squeezing your butt. From that position, we're going to drive those hips forward just a little bit, and we should feel that stretch in that probably upper thigh and right into that hip. We don't want it doesn't matter how low we get, that's not what we're looking for. We just want to feel that stretch high in the thigh, up in the hip, hold 30 seconds to 1 minute, slowly back out of it, and then repeat on the opposite side. Same thing, a couple times a day. This is really good, especially for those that have low back issues. All right, this is one of our favorites here. Probably the easiest exercise you will ever do in your life, and you won't even know anyone else is doing it. So very simple, chest up, back straight. All we're gonna do here is a glute squeeze, okay? Many of us, all you're gonna see happening really is we're only gonna move up about 1 inch off of our seat and then slowly relax all the way down. The goal here is just to tighten your glute muscles as tight as you can, hold for a few seconds, slowly relax. Again, the only movement here is you're probably gonna gain about ½ an inch to 1 inch in your chair and then slowly sit back down. This is good to do throughout the day, keep those glute muscles fired. 15 reps, 20 reps, a couple times a day is great to do here.
Good. Thank you, Rick, for all those great tips and tricks. Again, it's a great reminder for everybody to keep doing these exercises throughout the day. Notice how you really didn't need any equipment to do any of these exercises, maybe just a band. If you do these throughout the day, we guarantee that you'll be in less pain or reduce the pain by a lot if you have anything like what Dr. Ramon was talking about. Good. Okay, so let's go and talk a little bit about Airrosti real quick. So as of right now, this number is a little bit outdated. So we've seen over 1 million patient cases throughout the years here in Texas. With all those visits and cases, we have a 3.2 average number of visits. So this is about 3 to 4 visits to injury resolution. One of the big numbers that we're really proud to share on here is that we've been able to prevent over 15,000 surgeries. So these are all patients that were told that they needed some type of surgical intervention to get rid of the ache, pain, or condition they were dealing with, came into Airrosti, got treated, and after their treatment plan, felt like they no longer needed that surgery. This is a big deal because it's not only saving money, but it's also saving time that you can spend with family or doing things that you love. We have an 88.3% reported full recovery, but we compare that to 99.6% of patients that would recommend Airrosti to friends and family. Now, there's a little bit of a difference there. It's about 11% difference. You might be wondering why. And the true reason is that we did right by that 11%. Those patients came in, went through the examination. Within the first 10 to 15 minutes, we knew that we can't help them. So things that we can't treat in the office are broken bones, fractures, or torn tissues. Our doctors are able to determine that without an X-ray or an MRI. Once we determine that you're not a candidate, we can send you out for those procedures, but we're not going to waste your time and money at Airrosti. We want to make sure you get to the right spot. So we don't charge you for your visit unless we do actual manual therapy on you. So those first 10, 15 minutes, it's a good way to get a second opinion or get some answers to any aches or pains that you might be dealing with. This is also a reminder again of the different things that we treat. Like I said, we have some big players on here like plantar fasciitis, carpal tunnel syndrome, headaches, migraines. We also have lower back strains, anything dealing with disc issues. Again, if you do not see what you have currently going on this list, it doesn't mean that we don't treat it. It just means that we didn't have room for it on here. Best way to start off is by going through the examination with Dr. Ramon to find out if this is something that we can help you with. Is this something that maybe you can take care of at home with just some simple stretches and exercises? You'll be surprised how many times a patient comes in and it's only a 1 or 2 visit. It's just how we're talking about today, getting moving again, getting out of that repetitive motions really changes a lot of the aches and pains that we deal with. When it comes to locations for Airrosti, we have the Valley covered. So we have a clinic here in Edinburgh. We have Dr. Ramon, Dr. Cantu, and Dr. Badazo. We also have a new clinic in Airrosti, in Harlingen, so it's right off of the expressway of 83. We have Dr. Saragusa at that one. And then we also have a clinic in Brownsville. So we have Dr. Laura there off of Alton Glore. All of these providers treat the same. There's no difference between them. If you wanted to start off your treatment in Edinburgh, 1 visit, and then you find yourself in Harlingen at another time for another visit, then it's still going to pick up right where they left off. Now, this is not only in the Valley, this goes through all out of Texas. So if you find yourself on vacation in Austin and you find yourself injured, you can go start your treatment plan there and then finish it off here in the Valley as well. All of our offices are currently open and following all COVID-19 procedures. We don't have any people waiting in the lobbies. We're all wearing masks. Everything gets sanitized afterwards. All of our appointments are an hour long, so you'll get 30 minutes of manual therapy and then 30 minutes of rehab. Both of these parts of the treatment are very important, so we have to stay for the full hour, but we were always on time. So if you're scheduled at 9 in the morning, you're in at 9 and you're out by 10. We don't have you waiting for too long. The minute your appointment's in, you're in, and then you're out an hour later. So it's really easy to plan your day to make sure that you don't miss too much work, or you don't have, let's say if you want to plan dentist, Airrosti, and some other appointments, all you need to know is that 1 hour we need you for. So when it comes to benefit, we are a covered benefit with the Aetna plan from Hidalgo County. Best way to find out where you fall in that benefit is by calling this 1-800 number right here. So it's 1-800-404-6050. That just leads you to our San Antonio office. That's where we do all of our billing, all of our scheduling. Unfortunately, we do not take walk-ins. So everything that we do is by appointment. You can't show up to one of our clinics and then just expect to get seen. We always make sure that we schedule you so that we know we have that full hour dedicated to yourself or to the patient. If we have so many providers, the wait time to get on the schedule isn't that long. If you have your phone right now, you can open it up to the camera option and scan this QR code. It'll lead you to our website to where you can schedule an appointment. You'll put in all your information and somebody from our corporate office in San Antonio will call you to finish setting up that appointment. Again, 1-800, calling this 1-800 number is going to be your first starting off point. They'll go ahead and check your benefit, check the schedule, get you on there as soon as possible. This is my information right here. So like I said, my name is Juan Gaona at Airrosti.com. If you have any questions that were not answered during the webinar, or if in a couple of days you have another question that you said, oh man, I didn't get to answer that or didn't get to ask that, you can always email me. That's my job. I coordinate with all of the clinics. I can get you answers, or I can get you in the clinic if I need to as well. And then this is the last thing right here is just another reminder that we do have those VIP chats available. Again, scanning that QR code in the bottom, you can go ahead and register. It's an open schedule, whatever time you can. The only thing that we do ask is that you give us at least 20 minutes of some, one-on-one time with your laptop, your cell phone, whatever you can of, dedicated time so that you can talk to the provider, listen to what we're saying, and then we can give you the next, best option. So I hope everybody got some great information off of all of this. I'll go ahead and pass it right back to Diana to see if we have any questions.
Yes, thank you so much, Airrosti. At this point, we're going to start with the Q&A session. So as a friendly reminder, you can submit your questions using the Q&A forum in our Zoom webinar software. And the first question is, what other types of health problems can chiropractic treatment help? And I'm going to go ahead and repeat that. What other types of health problems can chiropractic treatment help with?
So I'll start off with this one. Our providers are chiropractors by schooling, but we don't do traditional chiropractic work in the office. So we don't do any adjustments or alignments. We focus on the soft tissue that surrounds the bones and the joints. So through our assessment, we'll be able to determine if the condition you're coming in for is something that we can help you with. Typically, any kind of pulled muscle, strain, things like that is something that we can take care of. When it comes to, arthritis and maybe some of those other issues, it'll be by case. So I'll let Dr. Ramon elaborate if he wants to on any of that.
Sure, thank you, Juan. Like you said, it's going to be on our end at Airrosti, it's going to be the musculoskeletal conditions that Juan was talking about. As far as like chiropractic in general, the scope of practice is very broad. There's some chiropractors that practice and focus on nutrition, so they can help you with a bunch of disorders or diseases that you might be having. There's also some that focus on more of things like acupuncture, so those can be used to treat a variety of things. I know some are doing some vitamin therapy, through IVs, through IV bags, for nutritional deficiencies. So it's pretty broad. The only thing chiropractors can't do is any kind of prescribed drugs or surgery here in the state of Texas, but those are things that you would seek care from somebody else. We do have referrals, a nice referral base if you're interested in something like that. On our end, it's going to be the musculoskeletal injuries that we're going to be concentrating on.
Okay, perfect. And I guess following up on that is, the next question is, should I limit my mobility if I have back pain?
That's a very good question. Sometimes, yes, it just depends, right? But if somebody has severe low back pain, if they really can't stand, if they can't walk, if they're really, really struggling right over there, they almost don't have a choice. They're going to limit their mobility. If you've had some back spinal pain for some time, it's just an old problem. The cure is mobility. It's our job on our end to find out what we need to do to make that patient move better. But what we do here, we first start out with the manual therapy first. That's my portion. I'm going to look at muscles that are really spasmed and tight. I'm going to look at spots that are really bothering the patient, stabbing sensations, pinching. We're going to work on that and get them ready to move, because they're going to move in our rehab portion. The last half hour, they're going to be doing their exercises, their rehab. So the combination of the manual therapy plus the active rehab, studies show that that is the best way to get rid and resolve these conditions right over here. So we often tell our patients movement is medicine, and of course you want to consult your doctor before you do start like an exercise program. Come see us if you have questions about, hey, should I do this movement? Most of the time the answer is going to be yes.
Okay, perfect. And the next question is, what if you had back surgery in the past? Can you still receive treatment at Airrosti?
Yes, yes, you can. In fact, currently right now, I am treating a patient who has had a previous surgery. We've done that several times. And that's because the surgeon's going to fix 1 or 2 segments of the lower back. We do have 5 discs in the lower back. And sometimes we bulge 1 or 2 enough that it needs surgery and you go get that repaired. But 10 years later, 15 years later, that patient is having some more low back pain. It's problems with the discs above and below the surgical site. And so that's what tends to happen, So it's our job to go in there and intervene quickly enough to hopefully prevent a future surgery for that particular patient. But the answer is yes, we can. We certainly can. And we're even doing rehab. Currently, we're doing rehab now for post-surgical patients, for those patients that get like a disc bulge repaired in their neck, if they get a disc bulge repaired in their lower back. Now we're doing the rehab for post-surgical patients like those.
Okay, great. And the next question is, with active children, they often do get pain due to sports. When is it a good time to visit a chiropractor?
I think, I'll tell patients if if it is a severe injury, yes, you want to go see a chiropractor. If it is something that's been bothering them for, let's say, more than 5 days and it's not getting better or it's getting worse, then it's definitely time to come in and get checked. So right away, a lot of times our parents are going to know, their kid got hurt and we get the phone call, hey, my kid got hurt today. Hey, my kid got hurt yesterday, and we saw him sprain his ankle. We saw him twist his knee. We saw him injure his lower back. Those kinds of things tend to happen. The sooner the better. The sooner you get evaluated, the better. And oftentimes your instincts are going to take over. You'd be like, my kid needs to come in. I can see them. They're not themselves. They're not able to walk correctly. They are having some pain during things like getting dressed or driving in a car, those kinds of things.
I'll go ahead and jump in here real quick too, and just remind everybody that the first 10-15-minute assessment is absolutely free. So if you have, like Dr. Ramon says, your child and within 2 days, yeah, something's wrong, go ahead and bring them in and we can do that evaluation for him or them. And we can say like, okay, yeah, it's nothing. He just needs to walk it off, or do we need to send out for x-rays, MRIs or anything? So you always use this as a starting off point.
Okay, perfect. And then the next question that we have is, will laying on the ground help with my back pain?
We teach something called emergency position, and that's for those patients that are having severe low back pain, the ones that are having a lot of trouble walking. So that is something that's going to help them. But in general, no, laying on the ground's not really going to help. We're going to show you some things like foam rolling technique where you're going to be laying on the floor to do it, but you're going to be doing this special technique, this special rehab exercise with a foam roller, which is a nice little cylinder of foam designed to help manipulate this fascia. So it's really, really good. Certain exercises they'll be doing maybe on the floor, but in general, I would say no. It's not a good idea to lay down. Again, the idea is to get the patient moving because movement is medicine. Okay.
Okay, perfect. And the next question is, can you get treatment for 2 conditions, back and hand, for example?
Yes, we can set patients up for 2 conditions at once. We generally like to treat these conditions separately, though, on each visit. If it's an area that's very closely related, let's say, for instance, a neck and a shoulder. Well, the neck and the shoulder is very, very close to each other, and they're very connected. They're basically neighbors, right? So they share a lot of the same muscles. So a lot of times we can treat a shoulder and a neck at the same time. If it's like, hey, my foot hurts and my shoulder hurts, we're probably not going to do that on the same visit. We're going to want to devote one visit completely to one of the injuries, and then maybe schedule a follow-up the next day to start the next injury, the other body part, you know? So it's possible. We can see a patient for 2 injuries at the same time.
Okay, sounds great. And the next question is, and I guess it's follow-up for another question is, will the athlete benefit from this service? People that
Can you repeat
run,
that?
exercise.
Can you repeat the question?
Yes. Will persons that are very into sports benefit from this service?
Oh my gosh, yes. We see a lot of patients that are in sports. We see patients that work out. We see patients that are marathon runners, that are triathletes. We see kids of all ages that are basketball players, track, football, volleyball's year round. You know, kids, you know, our younger patients these days are sports going on. You know, they play one sport year round, so there's a greater chance of injury. But yes, athletes are some of our biggest, some of the biggest referrals we get are from, you know, from teams and from sports patients.
Okay, thank you. And is there a way I can prevent back pain?
Yeah, we teach, you know, that's one of the things that I love about this job is after we fix a patient, they know how to prevent this back pain from coming back. And that's from the stretches that they're going to learn. That's from foam rolling. That's from doing things like lacrosse ball. That's from strength exercises that they're going to be able to learn here. So, you know, we can't really get into specifics, but yes, there's a lot you could do for back pain. I would suggest that everybody out there who's got a desk job and then it's working on their computer all the time, that every half hour, just stand up, you know, instead of being stuck on your computer for 8 hours straight where you didn't get up one time, but maybe for lunch, you know, every half hour, just up for 4 minutes. You know, you don't even have to leave your desk. You could stand up for 4 minutes. You're going to change your posture there and at least give your lower back a break. You'll at least stretch those hip flexors right over there. So that's important. But things, keeping up with mobility, like things like using a foam roller properly, things like stretching, things like maybe doing a little bit of self-release with the lacrosse ball, those are great for preventing flare-ups, or preventing lower back pain from coming on.
Okay, perfect. And then the next question is there coverage outside of Texas?
So we
yeah,
do
have, take that
one? Yeah. So we are able to take insurances from outside of Texas if we're doing treatment here in you know, the Valley and Austin, Texas, anywhere here. We do not have providers outside of Texas, but we do have a telehealth option, which is called Airrosti Remote Recovery. It's going to be the exact same thing treatment-wise. It's just one thing that we're going to be missing is that manual therapy that the providers do. But we have a rehab kit that goes out, so it's really one-on-one. You know, conversation-wise, if you were to sign up for it, let's say in California, you'll still be talking to one of our providers that's here in Texas one-on-one. So we do have that option available. If you go to airrosti.com. Look up for, it'll be there, Airrosti Remote Recovery or our telehealth services. You'll get all the information on there.
Okay, perfect. And then the next question is, what kinds of pediatric conditions does a chiropractor treat?
Yeah, so there's a couple that we do focus on. One is called Osgood Slaughters. That's a pediatric condition. That's when the, you know, a young kid has this bilateral knee pain. They'll have it both on the right and the left knees. And it's just from running and jumping and their growth and their development. So that's one condition that we treat in kids. Besides the sprains and strains and the tendinitises that they develop with sports and activities, another one is called Sever's disease, and that's one that affects the Achilles tendon in the back of the heel. Excuse me. So there's you know, a lot of pain that develops over there because the calf is too tight and it pulls on the heel. That's definitely another condition that we do treat. Other than that, it's going to be all the musculoskeletal injuries that can happen in sports or just activities at home. The repetitive type injuries there, okay? But for the most part, kids are very, very healthy and they do bounce back very quickly with our treatment. They bounce back quicker than adults do, that's for sure.
Okay, perfect. And then the next question is, Does chiropractic care help with better sleep?
That's something that we track here. We have about 4 sleep questions that we ask our patients, because that's key, right? If you have a bad sleep, you're not going to feel very energetic the next day. You're going to have a bad day at work, and then these problems, it's a bad cycle that you get into. But yeah, if you're tossing and turning because your lower back is making you very uncomfortable, we've got to fix that lower back pain. Shoulders are very common that we see where patients say, gosh, I'm not getting a good night's sleep. My shoulder hurts. I can't sleep on my side, and I want to sleep on my side. My neck hurts when I sleep on my side or when I sleep face up. I get numbness and tingling in my hands and fingers when I wake up. That's what can be keeping me up at night. So we got to resolve those conditions to get them sleeping better. So that's something that we do track. So yes.
Okay, perfect. And then we do have some questions regarding the coverage of the Airrosti services from our county's medical insurance. So I'm just going to go ahead and answer that one. Yes, it is covered. Airrosti is in network, and we will only pay the copay for a provider visit. So again, also Juan did mention that you can also call the 1-800 number just to get more information regarding our benefits that we have. And you can also go to our Aetna website and find more information for the locations that they have close by to here in the valley. Well, thank you so much, everyone, for joining us. Thank you, Rick, Dr. Ramon, and Juan for this informative presentation. Thank you all again for being with us today. I really appreciate your time and engagement, and I hope you have a great day. Stay safe and healthy, and have a beautiful day. Thank you.
Thank you so much.
Thank you. Have a great weekend.